Since 1983, FAME has helped business and education work for Maine. Contact the authority, the Finance Authority of Maine. You're watching Mainebiz Sunday, Maine's business news source.
Welcome back. We are continuing our discussions with Governor John Baldacci, taking a look back at his administration. I want to back up before we get into, I'm going to talk about Dirigo Health, but before we do that, I did want to talk about the budget deficit that we're moving into. As I mentioned, it could be $1 billion, maybe not. I want to get your kind of take on that. Where will the LePage administration be? What kind of deficit will they really be looking at, and what's your recommendations?
Well, first of all, I think any governor has to realize their responsibility is to make things better than they found it. When I became governor, we had a $1.2 billion structural gap deficit. We had no money in the reserves or the rainy day fund. And they had taken out a loan to cover the cost of tax anticipations that were coming in late. So they had a loan out there, no money in the reserves, structural gap, and then the night of my inauguration, you had Great Northern Paper Company declaring bankruptcy. Right. So I said to somebody, if we didn't start at the bottom, we could at least see it from where we started from. Right. And from that point to where we are today, we're going to be handing the next administration a reserve of about $50 million. We have built up the rainy day fund, so there's about another $56 million. We don't have a loan outstanding. And at the same time, the structural gap with the new economic forecasting will be about $840 million. Okay. So in half of the $840 million is taking education from its current level to 55%.
Is that going to happen?
Well, what I told the school districts, we did just, in order to balance the budget, I was going to do a curtailment, including them for a cut. But I said, no, you hang on to the federal money that you got from the Recovery Act, which they got $39 million. I said, keep your reserves. We're not going to have a curtailment, but I'm warning you now, in the next 2-year budget that I'm going to present to the LePage administration, I'm not planning on advocating for an increase to 55%. It's up to the next governor and the next legislature to decide. I wanted to take the tough act of taking the bullet for this and saying you weren't going to get any more. Plan with what you have. Use it wisely. Now,
so that's we're really looking at 400
well, if the administration decides to hold to that principle and to keep the resources where they are, it'll be $438 million or $458 million less than the 840.
Okay. Okay.
So it could, but at the same time you have campaign commitments and their initiatives and what have you. But I wanted to give them the best case scenario.
Good. Okay. Thank you. I wanted to move into health care. You ran for governor in 2002 on the pledge to, quote, bring affordable quality health care to every man, woman, and child in Maine. And let's fast forward now 7 years from that point, and we can see that the Maine Development Foundation and the State Chamber, they came out with their survey this summer of all businesses, and businesses are still saying that the cost of health care, the crushing cost of health care is how they put it, is still the #1 negative impact on their business. And just November 8th, just a few days after the election, Taryn Bragdon, CEO of Maine Heritage Policy Center, now the co-chair of Governor-elect LePage's transition team, told the New York Times that Dirigo will be Dirigone. How clever, huh? So I want to ask you 2 questions about that and let you respond. Considering your original campaign promise, so to speak, how do you think we did? How do you think you did? And knowing what you know now, what would you have done differently in regards to Dirigo?
Excellent questions. Excellent questions. I think to realize that health care is tied to your economy, is tied to your environment, is tied to your energy, it's all tied together. So an understanding that it's all integrated. So by addressing health care, it isn't like a separate island unto itself. Dr. McAfee, who headed up Dirigo and was a close advisor of mine, and he was president of the American Medical Association's national board, said to me, you've got to understand as a person, you can't walk into the emergency room and say, fix me, like you had nothing to do with the experience. You know, it is through our eating, drinking, and smoking habits that we compound about 40% of our health care dollars, premiums. So we have a responsibility. So I've often said to people is, we're part of the solution, we're part of the problem. So you can't escape that. Don't look for a handout here. You have to make changes in your lifestyles and habits. So in order to address the costs, you have to address that. Quality is also a big driver. We've established the Dirigo Quality Forum, so best practices are being shared by medical providers and also by hospitals. It's gotten high marks, not a lot of advertising. And as you saw recently, we've improved our quality standings. Maine is being now recognized nationally for the quality of our hospital, health care, and it's largely, they say, because of the data that's now available and the information that's out there.
So you're saying Dirigo had a part of that?
The Dirigo reforms. People look at the Dirigo Health Agency as providing insurance as the end-all, be-all, but there were many reforms that went with that, because you're trying to address cost, quality, and access at the same time. And we did it without raising taxes. One of the unfortunate things is people get into the rhetoric of doing away with Dirigo is that there's going to be $10 million that's going to be owed to the general fund if you don't have Dirigo, because it covers the parents of the children without health insurance. So there's a help to the general fund, to the taxpayers, and there's no tax dollars in Dirigo. It's an assessment on insurance companies that we have set up.
So if Dirigo leaves, there's an automatic $10 million
bill that goes into the general
budget
fund, because that's an obligation that's going to have to be met if you don't have those resources. Because we said if Dirigo expands access and includes more coverage and saves the hospitals and doctors and everybody else in healthcare, we want to assess that savings. We don't want to raise taxes. So that savings offset payment system, which the insurance companies took us all the way to the Supreme Court to be litigated because they didn't want to have, it just flies in the face of there's enough money in healthcare, you need to reprioritize it. Well, we tried to reprioritize it.
Okay. It's still, and just in general, I mean, this was clearly...
If I had to do it again, Alan,
Yes.
if I had to do it again, I probably would have changed the advertising to saying I wanted to cover 100 and 150,000 people. I wanted to. That's the way we started off. Unfortunately,
so the bar was set too high?
I set the bar very high, and when we got around to adjusting the funding that could be commensurate that, it came in at probably 10 or 20% of that figure. So people always held that over my head that I didn't do all of that. But, you know, when I run into a woman that tells me that without health care she wouldn't have had her cancer screening done like her mother had cancer, and she found she had it, but she was able to treat it earlier, or the family that's now getting the treatment for their child that they wouldn't have got otherwise. In this insurance product is market rate reimbursement. Doctors love it, hospitals love it, and it's not using any tax dollars. So it may not be the right answer, but I think it'll be part of the national health care reform.
But you had some guts taking it on, I will tell you that. Okay.
Well,
let me ask you, we're going to have to close this segment. They go by so quick, and I've got like 17 pages of questions for you. We're going to ask you some more in our web segment. But I did want to follow up with this one, this final one, the Forbes list. I wanted to ask you about that. Obviously, businesses concerned about that. The Forbes list for best states to do business. Maine came out dead last, number 50. Coming at the end of your 8-year term, that had to be disappointing and had to hurt. What does it tell us? What did you take from that?
It's not true. It's not true, Alan. I mean, I just left a company that's invested, Chinese company that's invested in Domtar, Washington County. Hundreds of millions of dollars are being invested. Businesses, the report that just came out, it's just not true.
But it's in print now, and it's in Forbes.
Print.
What do we do about it? How do we change that message?
Well, first of all, they've got to share the information as to how they came to the calculation. Was it based on temperature versus New Jersey, and that's why New Jersey's quality of life is better than Maine's? Is it based on the fact that we had tax reform that lowered the income tax on higher-end earners? Did we have that repealed? Do they know that it was being repealed by more conservative people because they didn't like the assessment on car repairs or something else to offset that? So find out what the rationale was for it. But, you know, I got to tell you, you asked about Maine Economic Growth Council came out with their report card. They gave us green marks and gold stars for improving the climate of business and doing business in the state of Maine. In the new consensus forecasting, the $400 million extra money is coming from corporations in Maine doing business around the world from Maine. So I said, it's not so bad being from Maine. So I think it was really disingenuous, and I think when you dig into the facts to find out why, my hope has always been about increasing the climate to do more business in our state, and I think most of the list that we have from Inc. magazine, from Fortune magazine, and all the others say that Maine is improving.
Well, good. I mean, that's good. I think I agree with you with most of that. There is a messaging issue there that we have to deal with, and the new administration will have to deal with that as well. We're going to have to wrap this segment here, but we're going to keep you around for an afterthought segment that we're going to show on the web. We can drill down a little bit more deeply in some of these questions. And boy, other ones I've got, too, like pine tree zones and tax reforms and
we got to talk
DECD and consolidation. We'll keep you around for a couple hours, so stick around. Thanks. You can catch
I'm looking for work.
That's good to know. You can watch more of this discussion in our exclusive Afterthought segment, seen only on the web. Just go to mainebiz.biz and click on the Mainebiz Sunday link. Stay with us. We'll be right back.
Mainebiz Sunday is made possible in part by funding provided by the Finance Authority of Maine.